What is sir? I can start now.
Honorable Chairman Professor Dr. A. Kanagaraj sir, AID Christian Research, respected our Principal Dr. P. Jugan, AR College of Arts and Science, young and dynamic research person Dr. MARUTHI Prasad, China Medical University, Taiwan, respected Professor Kumaran, HOD, Computer Science Engineering, Jaya Engineering College, HODs, faculty members, research scholars, alumni, and distinguished participants from the various university affiliated colleges, University of Madras, BTU, Bangalore University, and IGNOU. Ladies and gentlemen, a very good morning, one and all. On behalf of Department of Biochemistry and Chemistry, Jaya College of Arts and Science, it's my great pleasure to welcome today's resource person, Dr. MARUTHI Prasad, China Medical University, Taichung, Taiwan, to this international webinar on recent trends on Parkinson'S disease. So it's my pleasure to put a few words about the resource person. Dr. MARUTHI Prasad was well-versed in diverse areas, particularly cancer, neurodegenerative disorder, health and personal plans. It's a bounden duty to welcome Dr. Chandrasekhar, the principal, Jain College, Bangalore. I extend my warm welcome to Dr. B. Wilson, Professor and Head, Dayananda Sir College, Bangalore. And also welcome Dr. Ilagan Sir, Professor and Head, Department of Biochemistry, University of Madras. And finally, I welcome all the participants and also the outside participants to this webinar. Finally, I would like to thank our management, principal, for the guidance and support to organize this webinar. Thank you. Over to Dr. Chitra to introduce the research person.
Good morning and a warm welcome to one and all who are present here. I am Dr. S. Chitra, Professor in the Department of Biochemistry and Chemistry in Jaya College of Arts and Science. I am privileged to invite and introduce our guest speaker, Dr. MARUTHI Prasad of China Medical University in Taichung, Taiwan, for the international webinar on recent trends on Parkinson's disease. He did his UG in biochemistry at Sri Krishna Devaraya University in Anantapuram. He did his PG in biochemistry at Sri Venkateswara University, Tirupati. He had completed his PhD in biochemistry from Sri Krishna Devaraya University, Anantapuram. He was a research assistant and research associate in Global Institute of Biotechnology, Hyderabad. He also worked as a postdoctoral researcher in Shenzhen University, China. In 2017, he received his postdoctoral talent fellowship from Shenzhen University, China. In In 2019, he received Ministry of Science and Technology Research Fellowship in CMU Medical University, Taiwan. He is a reviewer in the Journal of Computational Toxicology, Computational Biology and Chemistry, Indian Journal of Natural Products and Resources, International Journal of Plant Science and Horticulture, Journal of Biomolecular Structure and Dynamics. He is also an editorial member in the Journal of Science Publication in Chemical and Biomolecular Interfaces. He is an enthusiastic and diligent biochemist with 9 years of experience in traditional medicines and mechanisms. He has published 25 manuscripts and 7 abstracts in peer-reviewed international journals. He is a member in Indian Science Council. He is expertise in preclinical and clinical trials such as post-translational modifications of cells using analytical assays, identification of novel plant extract to treat myocardial infarction, antimicrobial activity and also dose fixation studies. He is also expertise in cell culture and molecular biology techniques. I thank him for spending his valuable time with us for this international webinar on recent trends on Parkinson's disease. Now I invite our guest speaker, Dr. Maruthi Prasad, to deliver his lecture on recent trends on Parkinson's disease.
Yeah, thank you, madam.
I welcome you, sir.
Thank you.
And one more announcement. Participants are requested to type their questions in chat box during the session. Feedback link will be displayed after the completion of the test. Participants are informed to submit the feedback form to receive e-certificate. On submission of feedback form only, you will receive e-certificate to your mail. Once again, I welcome you, sir. Please continue this session. Thank you.
A very good morning to everyone. Myself, Dr. Chitra Madam introduced today. So, topic is the recent advances in the Parkinson's disease. So, myself, Dr. Maruthi Prasad, MSc PhD in Biochemistry. I'm working as a professor in Graduate Institute of Acupuncture Science, CMU, Taichung, Taiwan. So this is my personal profile as described by Dr. Chitra Madam. So we are going to discuss about the background, symptoms, and mechanisms, research strategies, treatment strategies, modalities of strategies, and future research perspectives in Parkinson's disease. So the Parkinson's disease is a neurodegenerative disorder. It means it affects the brain or nervous system, which the degeneration of neurological organs will happen in these disorders. So the disease affect the central or peripheral nervous system. So that is why these are central peripheral nervous system disorders. The mainly spinal cord, cranial nerves, peripheral nerves, nerve roots, autonomic nervous system, and neuromuscular functions will be affected by the neurodegenerative disorders. What happens when the neurodegenerative disorders occur? Then the structural or biochemical or electrical abnormalities will take place in the body metabolism. Every year, hundreds of million people are dying due to neurodegenerative disorders worldwide. The Parkinson's disease, Alzheimer's, other dementias means degenerative disorders, cerebrovascular diseases, including a stroke, is a brain stroke, a migraine, and other headache disorders, multiple sclerosis, neuroinfections, brain tumors, and traumatic disorders are the main neurodegenerative disorders affecting the people. So the mainly neurodegenerative disorders is the protein misfolding happens. You see, protein misfolding in our brain, like is the proteins will be unveiled, like they lose their stable structures, and the degeneration will happen. So this is a structure of brain, and these are the neurodegenerative disorders which will affect different parts of the brains. See, if we see the Parkinson's disease, it affects at mid brain parts, and the Lewy body aggregation will be seen in the brain neurons. So the degeneration will occur. So this is Alzheimer's disease and the prion disease and the frontotemporal dementia, so front brain, and the Lewy body dementia, and Huntington's disease, amyotrophic lateral sclerosis. So all these are neurodegenerative disorders uh, affecting the human. So going to the neurodegenerative disorder latest statistics, the death due to the neurological disorders happening worldwide. See the red color and yellow color. Yellow color means mild and red is severe. See per million here, the red color is around 1500 people are dying every year due to all these neurodegenerative disorders. In 2016, it was only 6.1 million, but it is increased now. But if you see in 1990, it was only 2.5 million people were dying. But this indicates the mortality rate is increasing rapidly. So research in this field should be concentrated to generate new therapeutic targets or new therapeutic drugs to control the neurodegenerative disorders worldwide. So the Parkinson's disease. After Alzheimer's disease mortality rate, the Parkinson's disease is a second one, and it's the most common neurodegenerative disorder seen in aging population, and it's associated with increased mortality and morbidity. Idiopathic, it's also known as idiopathic Parkinson's disease, primary Parkinsonism, hypokinetic rigid syndrome, paralysis, agitans, shaking palsy. So these are all other names of the Parkinson's disease. And the shaking palsy, this word was described by James Parkinson, who was worked on Parkinson's disease during 1817. In the honorary of his research, they kept the disease name as Parkinson's disease. This is a progressive nervous system disorder, degenerate the brain by the time rapidly, and it's well known as motor system disorder, and it's particularly occur during the age of 60 or above, but in some cases we can see it's around 20 to 50 also happens. Going to the symptoms, so bradykinesia, tremor, rigidity, flex posture, freezing of gait, and the people will become like this, means they can't able to walk, properly, their movements will be involuntary, and their hands or legs will be rigid. They can't able to freely move their body. Flexed postures, postural instability, freezing of gait, and this happens in the Parkinson's disease. So these are all belong to motor symptoms. When we see the non-motor symptoms, they are included like depression, difficulty in swallowing, chewing, and speaking, urinary problems, constipation problems. Constipation will be around 90% of people face these problems, and sleep disruptions or disturbances also seen in these Parkinson's disease people. So what happens?
Sir,
When
sorry to interrupt. Can you increase the audio volume? Because
oh,
many people commented slow audio.
oh okay sir. I increase the volume. Hello, it's my screen is sharing, sir.
Yes, yes, sir. Yes, sir.
Okay. Okay. Is it okay now?
Yeah, yes, yes, yes.
Oh, okay. So the Parkinson's disease mainly due to the loss of dopamine producing cells in the brain, that particularly at the part is called as substantia nigra. So this blue color part is um, the area which the dopamine metabolites the motor or non-motor emotions. Like see, if we see the functions of dopamine as related to reward, pleasure, euphoria, motor functions, compulsion, perseveration. So all these kind of feelings also carried out by the dopamine in our brain. See, if normal person is having this much dopamine, in Parkinson's disease people, they can lose the producing cells, thereby the low dopamine levels, and the signals will be less, and they cannot transmit their bodily movements or the feelings. They lose their emotions. So the Parkinson's disease death rate. See, this data is from 1999 to 2017. The data is from US. It's for 1 lakh people. There were 5.2 people were dying only in 1999, but if you see in 2017, it is 9.8. And if we see the Indian epidemiological rate, PD, it's differ from region to region. It's not homogeneous like other countries. See, the prevalence rate over 60 is like a 247, so it's very high number and compared to the other countries. And the southern part is only have 27 per 1 lakh people, and the northern part is 14.1% people are dying per year. In the eastern part 16.1, and if we see the western part of India, it's more than 300. So as we said, this is a progressively disabling neurodegenerative disorder. This is a part where, as we discussed earlier, see, this is a CT of brain. See, this is a normal person's brain tissues, and this is a Parkinson's disease people. However, if we do the scanning like this, also it's not a confirmation of Parkinson's disease. That's we'll discuss in further slide. So the symptoms also differ. from person to person and affects the nerve cells in the brain that produce dopamine, as we said before, and include these are all motor symptoms, and the diagnosis treatments can help to relieve from the symptoms. So there is no permanent cure, and this is another graphical representation for the Parkinson's disease brain and healthy brain. Healthy brain, you can see the cortex and putamen, digital cortex, substantia nigra, all tissues at the normal level. And here we can see the loss of dopamine, and there will be the symptoms of Parkinson's disease you can see. Then if the Parkinson's disease occurs before 21, it's a juvenile Parkinson's disease, and 21 to 40 it is youngest onset, and this is a latest classified stages of Parkinson's disease. It's stage 1 to 5. Here 1.5, 2.5 are new. So during the first stage to fourth stage, there will be no severity, not major severity, but in the stage 5, they can't move unless they get assistance from the people. So the risk factors for the Parkinson's disease is age and sex. Age, particularly the 60s, people are at high risk, and men are at high risk compared to women. And there may be 5 to 10% early onset, like maybe juvenile or maybe the youngest onset diseases. And lifestyle exposures also the risk factor. Genetic factors like risk-enriched repeat kinesis 2 genes, LINK1, Parkin, DA1, glucocerebrosidase, and other autosomal recessive disorders also prone people with Parkinson's disease. And hormonal and reproductive factors like estrogen, all these hormones also play an important role in the neurodegeneration. Traumatic brain injury, for example, if a person got a traumatic injury or brain injury, they also have a risk of getting PD, is Parkinson's disease. Different brain structures relate to the production of dopamine. It's all depending on the dopamine production. The people who expose to the metals, like for long-term exposures, I'm saying, mercury chloride, mercury industries, lead, manganese, copper, iron, aluminum, bismuth, thallium, and zinc. The people who expose to these metals longer times, they also have a risk of getting PD. And exposure to the chemicals, these are the pesticides, paraquat, rotenone, manap, and other pesticide exposure is also risk for the Parkinson's disease. People who drink the groundwater, normal water that contains trichloroethylene is also a risk factor for this kind of neurodegenerative disorders. And the drugs and some medications, prolonged medications, and the drugs, for example, heroin. The people who take heroin for in a short time also, they also have a risk of Parkinson's disease. And if we go for the diagnosis, Parkinson's disease do not have any specific test to diagnose it. We cannot confirm the test of Parkinson's disease. Based on health history only, they can confirm, but they need scanning reports of brain tissues. Physical and neurological exams also play an important role in diagnosing the PD. And these are the imaging tests. They can help to confirm the PD along with the symptoms. If we do the computerized CT scan only, it's not a confirmation. We need to confirm it with the neurological and physiological examinations should be accompanied to confirm magnetic MRI, and the DAT scan is a dopamine transporter scan. So this is thing to not confirm. We only confirm with physical neurological exams and the CT scan or MRI scan. Drugs used to induce PD in research. In research, we are using dopamine-like analogs for inducing Parkinson's disease in rats or mice or monkeys. So the 6-ODHA, 6-hydroxydopamine, MPTP, MPP plus, and paraquat, and the rotinone. All these are the drugs we use. All these five. Not this is a metabolite. They have a similar structure like this. So we use at different doses. We use all these to induce Parkinson's disease, and we test the the therapeutic effect of the compounds, new drugs, or some plant-derived compounds. So the 6-ODHA, 6-hydroxydopamine, is a structural analog of catecholamine, so like dopamine or noradrenaline. We do the lesioning, like means we do the surgery, brain surgeries to induce the neurodegeneration in mice or rats or monkeys by this like unilateral injections. Um, After once inject, the degeneration will go through a massive, and we do the unilateral injection, left or right medial forebrain injections we do to get the Parkinson's disease models. And bilateral lesion also done. Intracerebral ventricular injections also we do. Intracranial into the eye, we use this drug to induce the PD, and intranigral, the continuation of 6-ODHA, the molecular markers to motor symptoms. All the um, uh, parameters will be seen like Parkinson's disease we get after the 6-ODHA injections. The free radical and oxidative stress will be higher once the rat or mice get injected to these drugs. And dopaminergic damage, the dopamine cells they will damage by the neurotoxin, and loss at the injection site due to the surgery, and particularly affects the striatum of the brain, and loss of tyrosine hydroxylase immune reactive fibers, and the neurons. Rotational motor behavior also seen after the injections. MPTP and MPP plus. MPTP do not pass the blood-brain barrier in the nervous system, so it will be converted to MPP plus cation form to degenerate the brain tissues. So that is why we are discussing both at the same time. MPTP is a full name 1-methyl-4-phenyl 1236 tetrahydropyridine, and MPP plus 1-methyl-4-phenyl pyridinium. This selective destruction of dopaminergic pathways will happen, and extensionally used, mostly used chemical to induce this Parkinson's disease in animal models, and we maximum we do the subcutaneous injections or intraperitoneal injections or intramuscular, intranigral, intranasal administrations like muscle drops and intravenous injections we do. But in case of MPP plus, we only do these two injections: intracerebral ventricular injection or intrastriatal injections. We do the continuation. The decrease of dopaminergic neurons depend on dose. Will be seen, and they reach 95% of the neurodegeneration at higher doses will be seen, and so decrease of dopamine levels, and MPTP metabolizes the cation, as I said before, and motor disturbances in primates and rodents, hypokinesia, decreased movement, and the 30% complex 1 protein in mitochondria will be seen, such as a 30% deficiency. So once the mitochondrial complex 1 deficiency occurs, then the mitochondrial ATP is also decreased, thereby the bread also loses its ATP. Next, the paraquat. Paraquat, this is one of the toxic quaternary herbicide, pesticide, and exposing to these kind of pesticides enhance the risk of TB. It also affects the extensive fibrosis in lung, and subcutaneous injections, intraperitoneal injections, oral administrations, aerosol administrations, intragastric administrations are the lesioning methods to induce the PD by the paraquat. The continuation with paraquat. Paraquat also decrease the striatal tyrosine hydroxylase immunoreactivity. They increase the cyanocolline immunoreactivity. No clear motor defects will be seen, but slightly decreased behavior of ambulatory and stereotype on rotational activities can be seen. This accumulates in lungs and kidney, and thereby the toxicity will be measured to massive. Next, the pesticide that is rotenone is naturally occurring organic insecticide, but this also affects the complex 1 electron transport chain in mitochondria, and that leads to oxidative stress and reactive oxygen species production, and then loss of microstrial properties and dopaminergic neuron loss. Then the Lewy body aggregation will happen in the nigral striatum. The methods for inducing lesioning is like unilateral injections, right striatum or right substantia nigral part contracta, subcutaneous injections, intraperitoneal injections, loss of motor disturbances in rodents. So all the drugs which we discussed have the influence on neurodegeneration. See, the mechanism of dopaminergic neurotoxins. This is a blood-brain barrier, and for example, the first neurotoxin which we discussed is 6-ODHA. 6-ODHA will affect the substantia nigra pars compacta in the brain, and that leads to the deficiency of disturb the complex 1 production in mitochondria, and then leads to oxidative stress, and thereby the neurodegeneration will happen. And if we see the NPTP, as we said, it cannot pass the blood-brain barrier, but it will be metabolized to NPP plus by MAOB enzyme in the glial cells or astrocytes. That also affects the complex 1 of mitochondria, thereby the oxidative stress in the brain, then neurodegeneration. Next, the NP2 plus is thing on there, and then next paraquat. Paraquat use sodium channels to transport the from the blood-brain barrier into the nerve system. It also affect the mitochondrial complexes, and the neurodegeneration will happen by the oxidative stress. Retinol directly pass the blood-brain barrier and affect the complex 1 of mitochondria, and the dopamine neurons will be lost, and thereby oxidative stress and the neurodegeneration, that's the Parkinson's disease. So what animal models we use to do research in Parkinson's disease? So the thing mainly we use rats and monkeys Along with that, mice, zebrafish, Drosophila, and C. elegans, yeast, and pigs also be used for the research purpose. This is like see yeast cells and C. elegans, Drosophila, zebrafish, mice, rats, monkeys. So all these studies we use to benefit the humankind. The Parkinson's disease only affect to the humans, not to any other animals naturally. We are just using the neurotoxins to induce these diseases to test the new drugs, the behavioral studies. So for Parkinson's disease, as we said, it's a motor system disorder, right? So this motor system disorder is mainly based on the behavioral tests we can contain it along with the scannings. So many motor and non-motor dysfunctions will be seen. Appropriate behavioral assessment extremely crucial for the safety of novel PD therapies. And these are the animal models and qualities when we use neurotoxins, how they respond. See, for example, humans have all these PDRS, P-moving analysis. The Parkinson's disease patient rating scale, they have all these symptoms like motor symptoms or like P-moving analysis, hand reaching motor, rest tremor, fine motor, gesture or gait failure, other objective tests. We don't have other objective tests unless in Drosophila. Neuropsychological tasks. These are non-motor. This belong to the human emotional feelings. Here, if we are doing our research in monkeys, they have all the possible similarities with the humankind. And if we are using like pig or dog or cats, they have they do not have the similarities with the human. See, they have their own positives and negatives in the research. So that is why the people used to prefer mice models or monkey models in the PD research. So this kind of fishes and elegant, we cannot able to distinguish all the motor.
Hello. Sir, sorry to interrupt. Your audio is not very clear because many people commented it's not audible. I think your mic now is in the mute mode. Just check it out. Your mic is in mute mode. It's not shows.
Sorry. Hello. Now
Yeah,
it
yeah.
is okay.
Yes, fine, sir. Very good.
Oh, sorry for the interruption. So let me continue my work. Yeah. Hello. Okay. So yeah. Okay. So I continue from last two slides. Maybe some interruption had, I think. Sorry for the interruption. And the animal models we use in the PD research, the Parkinson's disease research, are like monkeys, rats, mice, zebrafish, C. elegans, and pigs we use. However, the Parkinson's disease only affect humans. No other animals uh, will be affected by the Parkinson's disease naturally. Just for the research purpose, we are using these kind of animals for the research. See, if we see the yeast cells, we cannot distinguish the motor symptoms as they are very important for distinguishing the Parkinson's disease. See, and we'll discuss like these monkeys. They have human-like symptoms. Uh, see, it's mainly motor disorder, right? So uh, here humans, they have all these PDRS, like a Parkinson's disease rating scale is like this, like they have a fine motor and rest tremor, hand itching, and all these parameters will be there in the Parkinson's disease. And the neuropsychological tasks, these are non-motor symptoms. uh, we see non-human primates, monkeys and marmosets, they have a similar like human or kind Parkinson's disease symptoms they can show, and we can confirm that by the scannings along with these symptoms. But in case of rats, we have some kind of positives and negatives in this, the qualities of the Parkinson's disease related mm, mm, motor symptoms. Next, going to the proportion from the research from 1990 to 2018, people who carried out the research in Parkinson's disease, they maximum they used rat models, just maybe due to the availability of things. And mice models is around 37%, 10% only non-human primates as monkeys, non-monkeys or marmosets, guinea pigs like that, and 5% non-mammalian uh, animals they use like zebrafish or something, cells like that. However, the Parkinson's disease is mainly the motor disorder, so the behavioral tests are very much important to confirm the disease through the scanning and the symptoms. Next, dietary support. The dietary support for the Parkinson's disease patients is very important, and not to treat or prevent with the diet. We are just suggesting that this can uh, give benefit to the people who are taking drugs, dopamine drugs or something for the cure of betterment of Parkinson's disease. So hormonal food, antioxidants, like berries and nightshade, vegetables, fava bean, plain green beans contain levodopa. So omega-3 fats, seeds, some beans you can use. This are the some of the suggestive foods for the patients of Parkinson's disease. And the treatment modalities. There is no permanent cure of Parkinson's disease. Uh, we are just using levodopa as a drug for Parkinson's disease, but still we just use the medication by targeting symptoms, just like the coronavirus. Just we are it's sort of affecting lungs, but the people are treating and targeting their lungs, right? So same like that, this disease also we are treating by based on the symptoms. Drugs designed to restore the dopamine levels in the brain, and the medications only relieve from the symptoms, not from the disease. So levodopa is used from almost last 30 to 50 years, but they are also using some new drugs from FDA approved for Food and Drug Administration of USA, bromocriptine, Paxol, and ropeneol, and other drugs. anticholinergics like benzotropine and trihexyphenidyl, and catecholamiне, like drugs like the catechol O methyltransferase inhibitors and tacaptan and chalacatran are the examples of that. And monohexamine oxidase B is like as we discussed in the mechanisms, we discussed that MAOB is the same enzyme we use here to control or regulate the complex 1 of mitochondria, and thereby the energy will be regulated in mitochondria of the brain, and then it will inhibit the neurodegeneration. And amantadine is a combination of levodopa and carbidopa. I heard that these days this drug is better when compared to the levodopa alone. The istradifilin also has emerged as a new drug for the Parkinson's disease, and no treatment can stop or slow the PD. It's a progressive disorder. It can degenerate our brain by the time. So that is why uh, the people and the research related to the Parkinson's disease should be more, and the practicability and cost. Treatment cannot efficacious, as we said, and it should also be sufficiently easy to use and sufficiently cheap to be accessible and available for any patient who may need it. And this is still far from achieved with many current treatments. Example, a significant proportion of the population cannot afford the cost of newest anti-Parkinsonian medications, especially in developing countries. Even in Western rich countries such as deep brain stimulation, other like neurosurgeries are not accessible to all the patients. So this Parkinson's disease need more concentration on research. So the neuroprotective drugs, this means they cannot cure the Parkinson's disease, but they can help to slower the PD, like slower the neurodegeneration in the brain. So anti-glutamatergics and pro-mitochondrial such as coenzyme Q10 and creatine, they can target the complex 1 of mitochondria, thereby the energy production and the levels will be regulated in the mitochondria. And the calcium channel blockers like istradifine and the growth factors targeting alpha synuclein in the brain, and monoxidase B inhibitors like serligin and resiglin. And for the PD research, the future research perspectives, the availability of an experimental model mimicking all the major pathological phenotype features of PD is crucial, and that remains to be addressed. Here in before slides, as we discussed that monkeys have the same symptoms like human. However, the symptoms are not very similar to the human. They differ. So that is why this disorder should be classified, or the research related to diagnosis and the treatment should be more, and the full understanding of PD pathogenesis, which with the identification of disease modifying therapies, and if toxic models, we have some genetically transgenic models of mice or monkeys. Still, they are also not consistent by the time if the neurotoxin or hello. Okay. Hello, excuse me. Hello. Yeah, the transgenic models incredible insights into selected molecular aspects of familial PD pathogenesis and LB-like inclusions, at least in alpha-synuclein overexpression animals. So, however, the absence of consistent neuronal damage of nigrostrial pathway remains a major limitation for the models in the PD research. So, as per the present and current research trends, we do not have a model of Parkinson's disease exactly resembling to the human. So the first we need to concentrate on the models that imitate the human, and the drugs, as we discussed about previously. We should improve the therapeutic targets more and more. So this is about the Parkinson's disease trends, and these are my publication list. And if you have any doubts, please ask me. Hello. Hello.
Yes, sir.
Yes, sir. Any doubts from the topic? I want to answer.
There's a question
Okay.
from Gayatri. She's a research scholar in clinical biochemistry.
Okay.
Kindly let us know what are the skills we should develop to become research scientists during our research period.
During research period. So the first thing, the first quality is like observing the things, reading the research papers related to the biology or clinical, anything. So reading the research papers is a second point. First, observe the research and read the research articles related to whatever the topic you have interested, and mainly we need to update every year. We have some standard methods in our books or something like that, but we have to update ourselves year by year and year by day, like that.
What are the lifestyle factors which affect dopamine levels?
Yeah. The lifestyle factors means if the people are taking high junk food, or having high levels of alcohols or toxic substances or carbonated drinks, it's not good for brain and the organs of our body. So the lifestyle should be in a traditional way, in my suggestions. Yeah. Any other questions, sir?
In what way yeast can be used to study model?
Sir, can you repeat it?
In what way yeast useful information? Sorry. In what way yeast can be used as a study model?
Yeah. The yeast also we use for the PD purpose, PD research. In this yeast cells, we use media to grow the cells in a nutrient plates or something like that. But we used less low concentrations of the neurotoxins which we discussed, like paraquat, or rotenone, or MTTP. This kind of drugs, we incubate the cells with this kind of neurotoxins, and we observe the changes in the metabolism of dopamine. We can measure the dopamine concentration from the affected cells and the control cells, like that.
There's another question. Is there any neuroprotective or disease modifying therapy slow down disease progression?
Neuroprotective or disease modifying therapies. Yeah, sir, we have a neuroprotective. I also given some examples in my PPT. Neuroprotective drugs. There is a lot of research is going on these kind of drugs, but we cannot control the PD with these kind of drugs. They can slow the degeneration of the brain, and they slow the PD, the progressive disorder.
What are the some benefits of participating in chemical trials?
Benefits means we can understand the mechanism of the diseases, how the disease is toxicating or protecting, like that.
Another question: only toxic material show on kidney, or due to PD, it will kidney functioning will reduce.
Yeah, see, the inflammation is a major thing in all the diseases. Inflammation. So inflammation will affect not only the brain; it can affect the heart, kidney, liver, all the other organs. So they are the side effects due to the diseases.
What's the role of meditation in preventing PD?
This is we can say the meditation is good for the concentrating and to resting the brain, I think. So if the brain is resting means the degeneration will be slower, but the meditation cannot prevent or cannot stop the Parkinson's disease. It can just give some relief.
Sir, can you stop your screen share?
Okay. Any other question?
Yes, so
Non-drug,
question.
non
Uh,
non-drug option. Non-drug option, non-drug. So without drug, we cannot do anything. So without medication, we cannot treat the brain degenerated cells.
Can you stop your screen share, sir?
Yeah, I have stopped it, sir.
Okay. So
Yeah.
click on your video, the camera. Just another question: why men are more prevalent to PD than women? Any specific reason?
Due to the hormonal imbalances, because women have a different kind of hormonal physiology, and men have different. So by the age of 60s, the human men lost they decrease their own hormonal levels, like testosterone. All these things will be decreased, so they are prone. Women they have all kind of hormone balance in a proper way. Not only the Parkinson's disease, many diseases are affecting men only maximum.
Does Parkinson's disease affect memory?
Sir, can you repeat?
Uh, can PD affect memory?
Yeah, it can affect memory. It's a motor. It's a non-motor symptoms. In non-motor symptoms, I said it's depression. All these things. In depression, the memory loss is also included.
Is there any way to cure this disease using stem cells?
Yeah, there are some kind of transplantations, but they are not 100% successful, and they are too expensive, and the availability of that kind of treatments are also not possible. Any other question?
Yeah, yeah. Is there any dengue symptom data set available on online repository?
Dengue, about
It,
dengue fever.
yeah, yes, yes. Is there any
Uh,
dengue fever data set available on any online repository?
maybe they can check the translational TCGA database, Transnational Cancer Genomic Analysis database. In that, maybe they can have about this kind of informations.
This is only neurological disease and
Yeah,
genetical disease, or not how they are affected humans.
yeah. So this comes under neurological diseases, but it is particularly a neurodegenerative disorder. This means the brain cells are degenerating. That means neurodegenerative disorder. So it is also a genetic disorder. As I said, maybe in the fourth or fifth slide, there are some LRRK2, Parkinson's, Parkin, DJ1 like that. There, if the genes have some chromosomal level abnormalities, they can also prone to the Parkinson's disease. So we can say this is a genetic. Sometimes it's genetic, and sometimes it is acquired. Not only a genetic.
Moti sir,
I think I saw some comments.
so Moti sir,
Uh, any other questions, sir?
can PD leads to Alzheimer or something? Alzheimer?
Yeah, we cannot confirm it. Not like that. If Alzheimer's is there, it is different, and it affects at different part, and Parkinson's also affect different parts. But at last stages or severe stages, it will affect whole brain. So it can be like both, we can say sometimes.
What's the reason South Indian people are less prone to disease?
Maybe the traditional food lifestyle, because as I saw many researchers related to the colon cancer. I saw some people there in south part of India. They do not have a less colon cancers, while the north part of India they have more colon cancers. And the research revealed that due to the traditional food lifestyles, they are not prone to the cancers like that.
I think Murthy sir, it's online. Hello, Murthy sir.
Uh, Maybe Murthy sir have some problems, sir.
Okay, so thank you very much, sir. Uh, spent a lot of time with us.
Yeah, I
This,
also.
thank you very much for spending a valuable time. I hope everyone enjoyed the session. Now it's time to conclude. So thank you very much for very informative session. On behalf of J Arts and Science College, Chennai, and all participants, once again, thank you, sir. So at this
Yeah,
juncture, I place my sincere thanks to our management, my thanks to our chairman, Professor J. Kanaraj, our Secretary Ma'am, Mrs. K. Kumari, our Vice Chairman, Engineer K. Navaraj, our Joint Secretary Ma'am, Dr. K. Tina, and our Principal, Dr. Gugan, and Rachodi, Dr. Murthy, and all our colleagues who rendered supported for this webinar series. So I request everyone to follow whatever the SAS said. If the valuable inputs, I can take it part in the research or any other further development.
Yeah,
So
Murthy
thank you
sir,
very much.
you want to
Thank,
answer? Yeah,
thank you very much. Thank you.
yeah. Hello. I also thank all the college members and students for giving this opportunity to talk today. Thank you all.
Moti sir, are you online?
Yeah, he's online, sir. He's online, but his voice is not. Yeah, his voice is not. Maybe he kept his mic in mute, sir.
Maybe.
Hello.
Yeah.
Now it's okay, sir. If you want to convey anything, just
Okay. Yeah. Thank you, Professor, and also thank you, Dr. Maruthi, for your wonderful presentation.
Thank you, sir. Thank you.
sir,
Yes.
so the feedback from it's in your end.
Hello. Yeah, it's there. But many of the participants are not able to open the feedback form.
Yeah, that's what sir. It's from your end. Just you can ask the
Okay.
madam to. I think it may not accept the feedback. So they have option
Okay.
where just accept text.
Okay. Just I'll put over to the Parimla madam to take care of that. No problem. Thank you, Professor.
Thank you. Thank you.
சார் அதுக்கே சார் ஃபீட்பேக் ப்ரோசஸ் இல்ல அவர் குமரன் சாரா ப்ரோசஸ் அது வந்து குறிப்பு கொடுங்க ஏன்னா அதான் கேட்பாங்க இப்ப எல்லாரும்
மேடம் உங்களை பார்க்க சொல்றாரு.
வரவே இல்லையா இத வர மாட்டேங்குது நீங்க பேசுறது எப்படி எல்லாமே